Dr. Salma Aziz, and today we'll be talking to you about neuromas. Sure, we've all had a friend or a family member that has talked about, I have neuroma pain. Well, what is a neuroma? A neuroma, by definition, is a damaged nerve, meaning a nerve that is no longer either structurally or functioning properly. When we're talking about the foot, let's go back to our lovely foot model. When we look at the foot, we're looking at these long bones. These are called the metatarsals, and we see that each metatarsal has a very round and bulbous head. And then we have the toes. Anatomy is important when we're discussing neuromas because by understanding the relationship of the anatomy as to what it is, it makes us understand the cause of neuromas. So again, looking at this, we have these long bones and we have structures that pass through these long bones. We have tendons, ligaments, arteries, veins that pass through there, as well as nerves that pass through and supply nerve innervation to our toes. So looking at this, we have this particular nerve that comes in between these long bones, and we have these nerves in all what we call inner spaces. So the space between these long bones is called an inner space, and we have nerves that pass through. Once a nerve gets to the head of the metatarsal, these ball or bulbous looking heads, the nerve splits into two. One branch supplies one half of this toe, and then the other branch supplies the other half of this toe. That's the anatomy of a healthy nerve. What happens in a neuroma, and we will get into the cause of it, is this nerve that is passing through here becomes pinched. In other words, the head of this bone and the head of this bone get too close to each other, pinching the nerve and causing the body to recognize that as damage occurring at the level of the nerve. When the body recognizes any type of damage, it sends inflammatory cells or repair cells to the area. Well, if we are looking at our model, we know that there's very little space to begin with between these heads of bones, and we already have quite a bit of stuff that goes through this area. The nerve doesn't want to have anything else crowding it on top of the bones and all the other structures. The body, trying to heal a damaged nerve, sends down inflammatory stuff down in that area, and it makes the space even more crowded. So now the nerve is being further pinched. This pinching of the nerve and the subsequent damage that occurs as a result of the pinching is what makes a diagnosis of a neuroma. Now, what causes this? Well, again, the number one cause of neuroma is the structure of the foot. How was this foot designed? How was this given to you? So genetic or familial predisposition plays a big role in this. Second, trauma. A lot of times, we women, more than men, will traumatize our feet. How do we do that? By stuffing it in shoes that it doesn't belong in, by wearing high heel shoes, such as in this position. Can we see, ladies, where all the pressure is coming in? It's coming in at the level of the ball of the foot, where that poor long nerve passes through the heads of those metatarsals and therefore gets traumatized with every step that we take in those beautiful high heel shoes. So this is more of a female problem. However, we do see it in men because of the genetic predisposition that it plays a role in men as well. Now that we understand what a neuroma is, let's talk about the treatment of a neuroma. The treatment of a neuroma can range anywhere from something as simple as modifying our shoe gear by adding more padding to an area where it has the ball of the foot, all the way to cortisone injections, orthotic devices, as well as ultimately for that patient who fails all other conservative means, surgical surgical treatment of the neuroma. So conservatively, shoe gear modification, we typically have patients use wider toe box shoes to provide more space for this crowded area. That's one. Second, we try to put patients in more of a corrective, controlling orthotic device to prevent the rubbing or closeness of these long bones that ultimately cause the neuroma. And further, we can add certain pads to orthotics that help separate these long bones. And then next we have cortisone injections as a means of treating neuromas. Cortisone will accomplish a couple of things. It can reduce the inflammation in and around that nerve. Sometimes it can actually reduce the thickness or shrink the size of the nerve. And oftentimes with that first cortisone shot, which has a combination of cortisone as well as numbing medication, this shot becomes a diagnostic tool for us physicians as well. Now, if we have complete failure with all of these mentioned treatment options, then surgery becomes the only option. And with surgery, what we're trying to do is we're taking a damaged nerve out of that area. Because as we know, and today, with all of the advances today, we can't really repair nerves. Which leaves us with the option of going in from the top of the foot, identifying the nerve, removing the nerve, so to remove the painful part. Surgery recovery is pretty average for foot and ankle type of surgery. 4 to 6 weeks is about average, and patients do very well with this, considering the amount of pain that they were in before surgery. So hopefully now we have a better understanding of what causes a neuroma to form and how we can treat it. Remembering all along that, once again, early diagnosis offers us the best treatment options. And that's the message I'm going to leave you guys with today. Till next time, thank you.